Hi, this is Dr. Dumestre, board certified plastic surgeon, and I'm going to go into the complication profile of deep flap breast reconstruction. So after your breasts have been removed, reconstructing them with that same person transplant, taking belly tissue up to the breast. Now, this is a reconstructive option that patients are very appealed by, as it's using your own tissue. You get a bit of a tummy tuck during it, and it's a very natural, very soft reconstruction. Given these are done like a transplant, they're longer surgeries, they require a hospital stay, and we're operating on two sites of the body. So patients often come with concerns over the major complications, being death, clot risk, deep vein thrombosis, or pulmonary embolism, and flap death. So you transfer this tissue, it doesn't work, and we have to throw it away and talk about other forms of reconstruction. Now, the good news is that those major complications are quite uncommon. The risk of flap loss is around 1%, so about 99% success rate. So it does happen, but it's quite rare that it does. Same with deep vein thrombosis and pulmonary embolism. It's really around the 1% range. So it is very important to get up and stay moving after these surgeries. When you're in hospital, we get you out of bed day one to prevent this complication, and someone's give you some small amount of blood thinner also while you're in hospital. The risk of death is minuscule. It's very rarely reported. It's not something that should happen with these types of cases, especially with appropriate workup. I mean, there's always the risk of that being triggered by surgery, but it really is minuscule in comparison to other types of surgery. As far as more common minor complications, the biggest one is wound healing issues. So it's a big surgery. There's lots of incisions, and so a lot of potential for a spot to open up. The most common thing would be a little scab or a little open area that you can do daily dressing changes for. Anything major requiring return to surgery, more intensive dressings, is a lot less common. Wound healing complications are more common in the immediate deep flap setting, and specifically as it relates to mastectomy flap necrosis or having some death of the actual skin envelope, because you have lost all of the blood flow traveling through the breast gland, feeding that skin on that day. Otherwise, hematoma, seroma, those are either fluid or blood collections, are pretty small risk, kind of in the 1 to 2% range. Infection risk is a bit higher, but very easily managed with rounds of oral antibiotics. Unlike when we have implants, it's a much bigger deal. And then fat necrosis or firm spots along the reconstruction are very common. The small ones are what's common, having a little small knot. Having a hard lump of fat necrosis is a lot less common, but does sometimes happen. It refers to areas of the flap that don't have as good circulation as other areas. So overall, it's a surgery that has a very acceptable safety profile. But that being said, it's still surgery. Complications do happen. It's unavoidable. And you just got to hope for the best. Go in hoping that you're a complication-free case, and knowing that if you do have complications, then we do know how to deal with them. Hope that helps. Have a great day.